Extra point seal hall is on the anterior midline on the glabella, directly between the medial ends of the eyebrows. Large intestine 18 is located on the side of the neck on a contour with a laryngeal prominence. It's in between the two bellies of the sternocleidomastoid. To bring the two bellies into relief, have the person turn their head against resistance. It becomes quite easy to see the sternal and the clavicular bellies of this muscle. Locate your point in between the two bellies and then have them relax their neck again. Large intestine 19 is directly below the outer margin of the nostril on a level with DO26. DO16 is located on the posterior midline at the base of the occiput. To find the base of the occiput, palpate down to about 1 cun superior to the posterior hairline. If you rock the head backwards and forwards very gently, you should be able to feel the cleft between the base of the occiput and the spine. Make sure you mark this point directly on the posterior midline. DO20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. DO20 is located 1 cun posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other DO points. So don't be tempted to go further back than 1 cun posterior to that midpoint. DO26 is on the anterior midline at the junction of the upper third and lower 2/3 of the philtrum. DO27 is on the anterior midline at the junction of the philtrum and the upper margin of the lip.
Ren 22 is on the anterior midline in the suprasternal fossa, 5 fen superior to the suprasternal notch. Ren 23 is on the anterior midline in a depression directly above the hyoid bone.
Ren 24 is on the anterior midline in the centre of the mentolabial groove. Stomach 4 is located 4 fen lateral to the corner of the mouth. It's in the nasolabial groove. Have the person smile and you can see this point falls nicely into that groove. Stomach 5 is located directly anterior to the angle of the mandible. So the first thing you need to do is to locate the angle of the mandible correctly. Palpate along its posterior border, inferior border, until you find where the jaw is changing direction. Then come forwards over the masseter muscle. the person clenches their masseter muscle, you'll be able to find a nice groove just as its anterior border, and this is your stomach 5. To locate stomach 6, palpate the posterior and inferior border of the mandible to find the angle of the mandible where the jaw is changing direction. Come 1 finger breadth superior and anterior to the angle of the mandible. When the person clenches their jaw, the masseter muscle comes up. When they relax, your finger will fall into the nice dip that is stomach 6. Stomach 10 is located midway between stomach 9 and stomach 11. It's on the anterior border of the sternocleidomastoid, so be sure to palpate down the muscle to find this point.
Stomach 12 is posterior to the midpoint of the superior border of the clavicle. Frequently there's a nice little notch there.
Sanjiao 17 is located in the dip behind the earlobe. It's between the ramus of the mandible and the mastoid process. Be careful that you don't put this point on bone. It's in between the bones in a dip. Bladder 10 is located 1.3 sun lateral to do 15. It's 4.5 sun from do 15 to the mastoid process. So divide this area into 3 and just come a little closer to the posterior midline. You'll be on the lateral edge of the trapezius muscle. Gallbladder 8 is located 1 sun directly superior to the apex of the ear. Frequently you'll find a nice groove in the bone just at this point. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Lung 7 is located 1.5 sun proximal to lung 9. It's located just a little lateral to the main line running from lung 9 to lung 5, in a cleft between the tendons of abductor pollicis longus and brachioradialis. It's located just at the base of the flare of the styloid process of the radius. In this position, the point is just about visible on the corner of the arm. If you locate the point too radial, it's falling onto the yang surface of the arm.
Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine 10 is located 10 cm proximal to large intestine 5 on a line heading towards large intestine 11. Palpate along that line and fall into a nice groove in the muscle at 10 cm. Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed.
Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpi ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in.
Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 cm proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella.